Good afternoon, and thank you everybody for participating in this session. Let me thank you first of all and welcome our exceptional guests. We really have a very diverse, international, and extremely qualified parterre. We'll get to know all of them one by one in a minute. My name is Stefano Cazzaniga. I'm a partner with Boston Consulting Group, leading healthcare payers and providers work in Southern Europe, and have the honor to moderate this session. Well, we'll be discussing how new technologies are and will revolutionize hospital care. All this, of course, in light of a sudden event which only 12 months ago disrupted our lives all of a sudden and at global level. We were all forced in a way to accelerate things that we're not able to implement since years sometimes, at least not at scale. I'm thinking of telemedicine, remote monitoring, data exchange, decision support systems, and so on, just to give a few examples. The pandemic also put the spotlight on some weaknesses of our healthcare systems, and it became extremely evident how pretty much all countries lack a robust primary care layer to bridge hospital and home care, but also put the accent on how we need to increase and regulate digital services. I will ask our guests to introduce themselves and their organization first in the first round of questions dedicated to the key learnings so far. So let me start with Dominik Pförringer, an orthopedic and trauma surgeon, academic director of Venture Lab Healthcare at the Technical University in Munich. Dominik, I pray you start introducing yourself. Then the question for you is, what's the role of Venture Lab and what have you learned so far through its perspective?
Stefano, thank you very much for the introduction, for the nice words. Thank you for the opportunity to speak with this high-level panel on this very interesting topic. As you already mentioned, my role is being an orthopedic and trauma surgeon at the Technical University in Munich, and at the same time being one of the 3 academic directors of the Venture Lab Healthcare at our university hospital. So with that role, you see that I'm both working as a treating doctor, diagnosing patients every day, working with patients, but at the same time very much dedicated to entrepreneurship. With that, I think we've seen that we are facing specific challenges that we could not imagine 1 year ago, probably in that dimension. And to put out the positive aspect after such a tedious time of different regulations, I think we've seen that digitization in the hospital can help us solve a lot of our problems in a faster and more effective way. And at the same time, we've seen that specifically the students of Technical University have made excellent use of technological solutions in that time. So we've basically learned what we've been lacking, the connectivity and also the understanding of digital solutions in the healthcare sector. And at the same time, we've seen that we have great opportunities. People are ready to undertake these opportunities, and that we should make use of that momentum once the situation is over. And with that, I think I can hand over to the next person trying to add their statement, and I look forward to a fruitful discussion with you and to all interaction.
So, Eyal Zimlichman, Deputy Director General, Chief Medical Officer, Chief Innovation Officer at Sheba Medical Center in Tel Aviv. Eyal, your hospital is listed in the top 10 of Newsweek global ranking, recently published. My question is, how did you get there, and what's the role of innovation in the context of your organization and your country?
Thank you, Stefano, and thank you for inviting me to speak on this panel. You're right, in terms of how we view innovation, I carry both hats at Sheba Medical Center, both the Chief Medical Officer and the Chief Innovation Officer. Part of the reason for that is to have innovation play a critical role in our day-to-day operations, treating patients, obviously providing value, and really the hardcore issues of healthcare. Many times innovation is set on the side, is not really dealing with the main problems that we have, looking maybe, to have financial gains rather than actual value gained for our patients. And what we've tried to do at Sheba is to try and link innovation to operations very, very strongly. I have one foot on the on the production floors of healthcare, if you might, and another one up in the clouds in the innovation, and trying to link the two, trying to find solutions to one of our, some of our most urgent problems. And my origin are coming from patient safety and quality in healthcare, understanding very much the gaps that healthcare has, and there are many, many of those gaps. We didn't need COVID to come around and actually show us that. Obviously, it has also exposed some of our biggest gaps. And that's why innovation needs to play a critical role. And again, I think post-COVID or during COVID, we're reinforcing that understanding. And what we try to do at Sheba is to start with the end goal, try to understand where we need to be, not just in terms of how do we solve one problem or the other, but where do we need to actually be 10 years from now? And then what we do with the innovation with our ARC model is trying to build and turn that vision into a reality in a very, very proactive manner, rather than being reactive, which is many times how innovation works. So it's a different model. It's become very popular in the past 2 or 3 years, even before COVID and even more after COVID. We have partners around the world that are working with us to turn that vision into a reality again, because it's not a one-man show and it's not a one hospital show and not a one healthcare system show. It's something that's much, much larger than just one body that can do this. And of course, I'll be happy to expand more during this conversation. Thank you.
No, thanks to you. I particularly like the two perspectives you introduced as two lenses to look at innovation. One more short time frame and clinical operations to be done immediately and how to improve it and how to win the challenges. And the other one is more forward-looking investments and designing or reshaping the way healthcare is delivered. Very interesting. And thank you. Moving to Franck. Franck Ouay, French engineer, what we call a serial entrepreneur, co-founder and CEO of Lifen. Franck, what is Lifen, first of all, and why and how did you decide to create such a company in the healthcare space? You don't come from that.
Yeah, thank you, Stefano. That's right. So I don't come from a background in healthcare, but I was when I started the Lifen. So this is my current startup 6 years ago. I was very interested to understand why this industry doesn't innovate as much as other industries, typically where digital is everywhere. It looks like, for example, we've had our banking accounts online for the last 20 years, and for many of us, we don't have our health account online. Why so? Why is it so lagging behind? And that journey of trying to understand why it's so hard to innovate led to the question of Lifen. So today we are companies that is operating in France and helping the data flow from hospitals to other physicians to patients. So typically we help 400 hospitals in France exchange medical documents in a digital format. That's about 2 million documents per month that are being exchanged on our platform. And this is just the first step to create some kind of a digital infrastructure to help innovation go from the labs to many hospitals. We see and we notice that, essentially when you want to, let's say if you build a game on the iPhone, you just put it on the store and you can reach billions of people, right? So if you build an e-health app today, once you've done building the app, you've done nothing. You have an Everest to climb, because just the fact how to distribute your app, enroll patients, enroll practitioners, how to collect the data from hospitals. It's a very, very tedious and a very costly journey. So essentially, we are missing some kind of a platform that can streamline all this and reduce all these costs. So we are trying to do that at Lifen.
Yeah, and probably the fact that, as you say, the medical world doesn't work like a proper market. So the distribution is point by point, hospital by hospital, facility by facility, doesn't help. And once again, underlines the need of some external agent to try and regulate this to facilitate the pace of innovation. Really interesting. While our guests speak, I encourage the audience using the chat box to ask questions, which will be then answering in the final part of the panel. So Thank you, Franck. And moving on to Luciano Ravera, a whole professional life in healthcare, currently CEO of Humanitas Research Hospital and Italian Academic Medical Center. Luciano, your hospital is considered a world-class example of organizational innovation, as an example from the Harvard Business School, which published several case studies. You also founded your own medical university in the past years. Question is, how's the situation doing in Italy, just to understand the country you operate in too? And what do you think are the key learnings from wave 1, wave 2 back in spring and fall last year? How did technology and innovation help you navigate the crisis?
Good afternoon to everybody. Thank you, Stefano, for the introduction, and thank you for inviting me. So we are in Milano, and we were really in the midst of a huge wave in March. And fortunately, I should say, we were one of the most digitalized hospitals in the country. So having an electronic medical record really helped us from the very beginning, because if you think that we ended up with 4 different intensive care units, one of them for non-COVID patients, and 2 of them located in different locations within the hospital, and 1 in the city center of Milano, in a regional hospital where we managed one of the modules of intensive care unit. All of this was possible through digital and through data exchange. Also, during the first wave, we became one of the 2 hubs in the stroke network in the Milan metropolitan area. And again, data exchange between spokes and hubs was really key in the care of stroke patients. And I should also say that, thanks to COVID, not only Humanitas, but most Italian hospitals really accelerated their ability to work digitally. So from March, and if we look at Italy's situation right now, the number of teleconsultations, of online visits, of second opinions online has really increased. Of course, there's still a lot to do, especially, as Franck was saying, in terms of data exchange between different hospitals, between hospitals and clinics, between hospitals and general practitioners. So I think that in terms of data exchange and availability of patient data among different providers, we still have a lot to do. And I guess I stop here for the first question.
Yeah, thank you. Let me just ask a small question before we go ahead. You spoke about data exchange amongst hospitals and said it's a bit of a challenge of today. What's the situation with the payers, both on the public and the private side? Anything better or still challenging?
I should say that I see a clear trend to improve the situation, but in terms of, especially of private players, as you may know, we still have a great difficulty in integrating, our data to insurance or mutual companies' databases. A bit better in terms of public system and in terms of national health system, where we deal with a system which is more used to exchange both administrative and now clinical data.
Yeah, sounds promising. We are not used to say that the public sector, at least in our country, is more advanced than the private sector, but this is a good thing to hear. Thank you. So let me now call in Ségolène Perin, Director of Innovation at ELSAN, and the only woman on the panel, so happy Women's Day. Welcome and thanks for joining. Ségolène, if you take an even broader perspective, how did COVID accelerate the adoption of innovation? And on the other side, which are the hottest topics and areas of investment under your perspective?
Sure. So thank you. I was actually noticing that I was the only female representative on the round table. So very happy to bring this perspective to the table. So ELSAN is a group of 120 private hospitals in France, and we cover approximately 2 million patients per year. So we have a broad coverage, and our role as an innovation head is really to bring a very pragmatic new solution to 3 different targets. The first one being the patients, bring new services, better solution for them to understand the pathway and to be well served. Second being the physicians themselves and all the caregivers, because they struggle sometimes with all tools. So we want to bring some very efficient tools for them to be able to cure the patient. And for instance, Lifen is one of them. And the third one is the hospitals themselves, because we need continuously to improve the efficiency of our organizations. And I share with Eyal this vision of innovation being very operational in the end, and not only the shiny cover of what we want to show to the public, but really it needs to bring some concrete operational improvement for it to be adopted by all the stakeholders. So I would say in the end that our greatest challenge is to convince the users, because they are doing what they do to cure patients, to improve their condition of life, and their goal is not to deploy innovation. So they always have this benefit, risk, or time perspective, and if we show that we bring a real benefit, then they will adopt it. We need to help them to make new procedures and to have user-friendly tools. But this is really the first thing that we need to demonstrate for them to be able to adopt the tool. And second of all, I would say that investing in innovation in healthcare is great, of course, but at least in France, we always need to find a win-win business model with the company bringing new technologies to the hospitals, because as you may know, prices are regulated. So it's not because you have more innovative tools, because you improve the services to the patient, that you have higher prices. So we need to find solutions that bring back some time to the caregivers, or show more efficiency for us. So as the software company is a winner and can sell its products, we also win something in the meantime.
Thank you. I mean, I pick up on a couple of things you mentioned. It is probably true that, I mean, even long-term innovation goes through some operational innovation in daily routine. And the second concept I like is we're all speaking about patients, of course, their experience, the clinical outcomes, and so on. But you also mentioned releasing time for caregivers, which at the same time goes for a better quality of their professional life and ultimately productivity or efficiency of the system, so sustainability in a way. So as a way to improve sustainability, using technology to improve the professional life of the caregivers, which is a very interesting one. We'll be back on this in a second. Thank you very much. Last but not least, and apologize for my accent, Stanislas Subra, Head of Corporate Venture Capital at the Mutuelle d'Assurance du Corps de Santé français. Good afternoon to you as well. Stanislas, there's no innovation possible in the absence of funding. You clearly are in the best position to help us understand what's the role of supporting innovation and how your organization, which is a peculiar one, has decided to approach it. So if you could drive us through your organization and what's your perspective on supporting innovation?
Sure. Thanks, Stefano, for giving me the opportunity to talk on this panel. I'm delighted to be there. And so to give you a little bit more color about our company. So MACSF, it's a leading insurer pension fund for doctors in France. We have around 1 million doctors, policyholders. It's non-listed, so it belongs to the doctors, and we have as an insurer, we insure them for their professional as well as their personal life. So, and we have only in France, so we're only in France, but we have around 30 billions of assets, and we think the company on our board, the board of directors is composed by doctors, and we think considering of course the news, the fast pace of innovation going into healthcare, we think it's also a part of a job to help the doctors to build a better healthcare system. So our insurance policy in France is mandatory for that the doctor is covered against casualties, and so I think the company is looking at innovation that's safe, helps the doctors save, for example, time for their practice. So it can be non-medical. If you, I'm sure we can discuss it with Franck from Lifen, which has a very good solution for that. Our objective is to remove pain points within the system and to build bridge in between the legacy, what I call the legacy healthcare, the legacy healthcare organization, and the new innovation project. So we think there is clearly a good path to achieve that, and to increase partnerships between public healthcare organization as well as private hospitals. So we are looking at the moment at deep tech innovation that's also enable the doctors to enhance medical practice, such as diagnosis with today with artificial intelligence you can do great things, but the key point is to find a way to collaborate with the global practice of the doctors, and to find the good path for the patients. We can invest to be more specific about the strategy. We can invest from seed to growth stage a couple of $100,000 to a couple of millions euros in startups. And we have we started the program 3 years ago, and we have around 10 investments. And we have promising companies. We want to back some founders that are able to expand around Europe. So a little bit to give you the in a nutshell our strategy.
Thank you very much, and thank you all for this first round. I'd say many interesting hints, which will trigger hopefully a lot of deep dives and further interactions. I once again encourage the audience asking questions to the panelists through the chat box, so that we feed the final part of our discussion. And would now like to try and inject some more optimism to the discussion, taking a forward-looking perspective and asking all of you, how do we get prepared to what the experts call the new normal? We've observed a lot of innovation coming to market, and some of it was trial and error. And we still don't know if it will last and will be part of our future, or it will simply disappear because it just was a patch on a specific need of the period. My question is, can you give us some more tangible examples of what is left to stay, in your opinion, in your sector, which will reshape and improve the way we deliver healthcare? And I'd propose to follow the same order in the first round. So let's start with Dominik, please.
Stefano, thank you once again for this first very inspiring round, where I think we learned a lot, both through the international combination as well as the diverse backgrounds of people that were put together. If you ask for specific examples and highlights, of course, from an orthopedic and trauma surgeon's perspective, it is a little bit difficult, because we are a very physical part of medicine in terms of that we need to examine people physically. However, I have learned that you need to be agile in your movement. You need to start quick testing relatively early to get back into shape. And you need to offer a lot of your services in a digitized way. That's not only video consultation, which is one important part, which we've all learned, and I think most of us have increased, but also being able and being willing to sort of, under certain circumstances, make a home visit rather than have the patient come to a place which he considers risky. So it's just about being agile and leading sort of the reaction and sort of offering by going forward in action, not only just be in a reactive position. On a more global perspective, or at least European perspective, what I would really appreciate if we have the best learning examples after this. I'm absolutely certain that this will not have been the last wave of a pandemic of some sort that we will experience, and it could come back in the next 10, 15 years, because we've seen a couple of viruses now around the planet. Of course, none of that grave shape and extension as this one. But I believe that we will have to adopt very quickly on how to react in the future. And I think we have some very, very good best practice examples. And I think we should share these afterwards, and also should, as we all should do every day, be very harsh in the criticism of what we did wrong and what went wrong through that time. Because only if we are harsh and if we're very straight on that, can we learn from what has happened right now and approach in a better manner in the future potential next waves, next diseases, and next circumstances that will be changing. So with the positive aspect, I'm fully optimistic that we've learned a lot. I hope that we're reaching the end of this entire situation relatively soon as vaccination picks up around the planet. And I'm sure that we will come out of it stronger than ever before.
Yeah, and I thanks for your comments. And I also realized that, I mean, as you said, being a physical part of medicine, you know, the transition to digital is particularly challenging, not so obvious, because there will always be a part of your job which requires physical interaction with patients. However, innovation and technology can help you improve all the rest, in a way. So moving to Tel Aviv, Eyal.
Sure. So, you know, I think, first of all, just to mention on a broad scope that, you know, all of us dealing with healthcare, and I think most of us here on this panel, you know, have been living in this area for, you know, most of our professional careers. You know, I think we do enjoy the extra attention we're getting. You know, I think this is obviously in times of pandemic, when healthcare has become so central for good and for bad. You know, we're enjoying this attention, which typically doesn't really happen. On the political side, you know, in Israel at least, and I'm sure in other countries, you know, nobody wanted to be the health minister at the end of the day when a new government is being formed. Well, today everybody is rushing to be the health minister. And of course, we're getting more support, financial support, and of course, more attention where on every channel, on the news channel, on every hour, where, you know, the news is starting with pandemics and healthcare and solutions. So definitely, I think overall, when we look at this pandemic, and as we go out of this pandemic into the post-COVID era, I think overall healthcare will gain a lot from the extra financing and the extra attention that's being projected at healthcare. It wasn't the most central of areas before. And so that's one thing on a general note. I think besides digital health and of course telemedicine, which we all talk about so much, And I think that's pretty obvious in terms of where we're going, and the fact that COVID has accelerated development on digital health on many fronts. That's pretty given. I think we're not stating enough what the vaccination science has gained in the past year, especially through the mRNA vaccines, which were a big question mark a year ago. I remember a couple of years back reading about Moderna, a small company coming up with this idea of a messenger RNA vaccine. People were very skeptical it would work, and they seem to be winning. They seem to be revolutionizing how we're dealing with pandemics. And I think this is a huge win for science and healthcare. And obviously, as we look at the more optimistic factors, that's another one. And of course, the data coming out of Israel now with the mass vaccination projects are very much optimistic. And finally, to note another thing that will be central as we move out, and that is, again, I think it was mentioned on one of the answers before on the previous round, and that is the public-private partnerships we're seeing. In times of pandemic, we're trying to put aside differences. We're trying to put aside, it's us against them, public versus private, profit versus non-profit. And there's been a lot of skepticism and a lot of tension between the for-profit and the non-for-profit, reminding you just pharma companies. We used to look at them as the enemy of the public health sector, while today they are the rescuers coming to the rescue of the world. And I think that kind of tension is going down, and we're going to see much more happen between public and private partnerships in the next years to come. It's an integral part of our ARC innovation program. We have it as one of the 4 ARC principles: open innovation, working together with industries, finding models that would be a win-win for everybody. And I think, again, COVID and going through the last year, and what I expect will happen in the next few months, is that we're going to see much more value coming out from those connections and collaborations.
Yeah, thank you very much. I would ask Franck to add his own perspective, and how does he think, maybe specifically to his business and his startup, but more in general terms, as per the market he's been observing and studying, which is healthcare in general. What do you see in the near future? What is here to stay? What do we need and will change the way we deliver healthcare, according to you?
Yeah, well, I think COVID was some kind of a rehearsal for what we will see in the future. If you look at the numbers, our population are aging. In France, there will be a 30% increase in people over 80 years old within 10 years. At the same time, the chronic diseases are, people are having more and more chronic diseases. The world is getting obese. So we see the demand for healthcare is skyrocketing. And at the same time, we already have shortages of doctors in some places. So if we don't do something dramatic, we won't be able to sustain the system we have today. So we know digital will have to be part of the solution. It has to happen, and it's taking some time to build, all these things. So we need to act now if we want to be in a good situation in 10 years. Of course, I think it was some kind of a wake-up call, I think. COVID, we all understood that, we need to act on that, and it's going to change. And we're just scratching the surface. Everybody's talking about telemedicine, but it's just, it's just the beginning. If you think of, if I make an analogy, before, when you had a car, you used to go to the garage when the engine was broken. Right. Today, you have sensors everywhere, so your car never breaks down. You just when the light goes off, you just go to the maintenance, and digital should make us do that. Having like sensors that can monitor what happens to our body, do a lot of prevention. So there are so many things to be done, and I think we have to take advantage of this crisis to collectively, and I like what you said, Eyal, we have to break the silos. We have to all work together, the payers, the hospitals, and startups to collectively work on, the financing that needs to be done to finance those digital solutions, the solutions themselves, and of course the hospital and physicians to adopt them. So this is super exciting. I think that there has never been a better time to work in digital health, but there's a lot of work to do.
Hopefully. And we all agree. I see the thumbs up. Back to Italy and back to Luciano. Luciano, I mean, I heard the 2-3 things that probably you might help me elaborate you have some of the answers. The first one is the shortage of medical professionals in general, of clinicians, and how you're facing that. The second one, being you a private institution, but working intimately with the public sector, being a tertiary care hospital with an emergency room and being a part of the hubs in your region. So second topic is the PPPs and the relationship and the collaborations. And the third one is about digitalization. So how do the three of them, if you help us understand how you are tackling with these topics or issues in your hospital, and a little bit of future outlook.
First of all, I fully agree with Eyal's first comment. So hopefully healthcare is now a top priority in our political agenda. I mean, I guess I can speak for Italy, but for Israel, I heard it's the same. And for Europe overall, I guess it's the same. So moving from being underfinanced to, let's hope, to be one of the priorities could help over the next future. In terms of medical scarcity or medical availability, I really think that we are moving towards a kind of task shifting in Italy too. So I'm sure that over the next few years, we'll see a healthcare which is less physician-centered and with an important role, a more crucial role to nurses, technicians, physiotherapists. I know that Italy lags behind, but I'm sure that this trend is there and will be an important one. And I guess not only in Italy, even for countries which are forerunners in this trend. Digitalization means also a different hospital in terms of design. So probably we are going to have different hospitals from the ones traditionally built and projected. I mean, the traditional workplace will be overcome. It is true what Dominik says. So, of course, most of our delivery is still a physical delivery, but we are moving towards a more virtual hospital, I would say. So a hybrid model, hub and spoke, hospital and community care, physician and non-medical, but clinical professions. And of course, again, data exchange, the availability of patient data will be key to be successful in this trend. A final point, we should move from acute care or a model mainly based on acute care to a model where we should be more careful in long-term care management. So moving from caring the sick to keep your population healthy. That would be another important move, both in terms of economics, financing, of course, but also in terms of future roles of us providers and also of new players in this industry, I guess.
Yeah, picking on your last point, I mean, moving from acute care and episodes of care into care management and helping the population stay healthy. Does regulation allow this already, or are discussion ongoing? So what's the challenge here? For sure you have doctors, for sure you have a medical school and all the competencies to deal with this, but ultimately the system perceives you as providers of this or that intervention, this or that diagnostic, and so on. So the perception is really...
Now, I'm sure, and I'm sure that, I mean, you agree on that. I mean, we should move from a pure, let's say, DRG payment to payment which is focused on value. So we would like to see some trends from a pure DRG or fee-for-service to a DRG plus quality plus outcome measurement. So some kind of KPI which is based on the quality of the service you provide over time. And I'm sure that a trend is there, not only in Italy, but all over Europe, I would say.
Because what we read on newspapers, what we hear in several discussions we're having in this period is that COVID is accelerating the dehospitalization trend.
Yeah.
So in a way, is raising the necessity to have an intermediate layer of care. But this doesn't mean that hospitals will ever or can disappear. So in identifying that their role probably is a real challenge from now on. Thank you very much. Let me move to Ségolène. Ségolène, on top of the overarching question, what do you think is here to last that will improve care? You for sure have a view on collaborations across sectors and how they can play a role to accelerate the change. What do you think?
Yeah, sure. First, I completely agree with what has been said about public-private partnerships and how the crisis has probably accelerated, and also for something sustainable, the way we collaborate and the way we share values. So this in France is also true, and we obviously hope that it's going to last. I would say in terms of what is here to last, two main observations on my side. First, everybody mentioned telemedicine, but I truly believe this was a real kick for telemedicine use by physicians and also by patients. And because of this benefit-risk balance I was mentioning before, most physician, and at ELSAN we have a lot of surgeons. So of course, like Dominik mentioned, when you are a surgeon, you want to touch and you want to see by yourself and not through a camera most of the times. And because during the crisis, there was a higher benefit of seeing the patient through teleconsultation, a lot of them started this exercise, and actually it's now stabilized. So at ELSAN, we have more than 6,000 physicians working with our hospitals, and less than 200 were using teleconsultation for their daily exercise, daily practice before crisis, and now it's around 1,000. So we really see that this has increased, and this is stabilized for also a better quality of life for some physicians who are clearly mentioning this as one advantage, and better access to the care for patients. And I would say that the second main input of the crisis is also probably data management and data use in decision-making processes in the healthcare sector. Of course, too much data is not good, and data needs to be interpreted in the good manner. But for instance, at ELSAN, we are a very data-driven company, and I think this also has helped us to accelerate some of the data management system. For instance, for supply management, we had, of course, to be very strict and very streamlined for mask and also gel supply management between all the hospitals. And this has accelerated the way we use data and we structure data. for other services in the future.
Yeah, thank you very much. On data, I have the following question for you. I mean, we've heard during several interventions, being a digitized hospital, you said we are a data-driven hospital or group of hospitals. I've heard we are the most digitized hospital in our region and so on. And I feel like everybody is, in a way, reinventing the wheel internally to become a data-driven organization. And we are still not able to find a common denominator and exchange this type of information that will boost the power of the data you already collect across organizations. And this is true probably in the payers-providers relationship, because none has the full picture of the patient life, but also true across hospitals, at least in the countries where patients choose on an opportunistic basis, based on the episode of care. I do my trauma surgery here, I do my cardiovascular there, I do prevention in another place. So in some cases, a patient is served by a single institution, which is better for them because they collect everything. In some other places, this is not real. What's your impression on this, and what's happening in France and in your hospital?
So, of course, patient data is key to improve the system efficiency, and the French government is trying very hard to have a better management of the data. We also try to contribute in this manner, and notably through the DMP, which is supposed to be the French patient management system for all French citizens. It's something that, of course, is done by step, and because you mentioned that the system can be different in France, you are free. You can go to the hospital, you can go to a private hospital. So data cannot be held in a single place, and most of all, we have historical system, IT systems, which are complexifying the data structure. So obviously, we are trying to simplify that and give access to the patient to its own data, and also simplifying the way physicians need to share data, because of course now we are incentivized to share data, but sometimes it's not easy at all for them to share data. So I think also with what we do with Lifen, for instance, is taking part of this initiative step by step.
Yeah, step by step is probably the word, but we all want to see something new and different, and the acceleration we've seen in the past 12 months is certainly to be kept, at least in terms of the pace at which we are now used to see evolution and change. I mean, the reactivity was from the systems overall was great, and hopefully this is another thing that will stay. Stanislas, once again, you have the privilege of the closing intervention. What's your perspective on?
Well, what I would say is that the good thing of the crisis is that the innovation will accelerate. So as some mentioned before, we need innovation to remove pain points. For example, if you see the shortage of medical doctors, technology is of course a way to help the overall healthcare community delivering better care to the patients. And the good news also behind it is that all medical doctors are seeing now that technology will not replace them, but help them. So I think it's a very important point. I think the future will be a mixed practice between physical, because there will be we all still need, of course, physical and meetings and care, but it will be more. We will use digital tools as assets and as new ways to build the relationship with the medical community as a patient. So I think it's very good. Whether you can do, for example, urgency, for still. There has been, in France, it's very well known that people are coming to the urgency at the hospital for not a very severe disease or health issue, and it's a lack of opportunity for other patients that are waiting, that are looking for this for them a very serious problem that needs to be that needs to go into, for example, into the surgery. So I think for example, with telemedicine, you can have and most of all, not telemedicine on the whole, but new tools, digital tools, with telemedicine linked to the organization. Doctors can follow their patients in a better way, so which is very promising. Of course, it will take time. It's promising. I think the technology is there also. Cloud-based services are getting more tractions, and if you look at what Lifen is doing, they are building bridge in between legacy systems with which is quite complex, and the new tools such as technological tools such as AI to build better solution for the patients. I think a medical device, when we talk about IoT and medical device are very important, and that will became more and more important to do preventive care also. As a mitigation point, I would say that's data privacy is also a key point, and it's not as easy to accept this concept of this idea of data getting into, for example, DMT was Ségolène was talking DMP talking about. So it takes time, but if we find good ways, I think there is a good hope for this to build the good infrastructure for the new tech infrastructure. Then we're able to do research, new research, artificial intelligence based of this medical data that are key to for example, to find new cures, and so it's quite exciting. And if you look at AI in terms of diagnostic, it's really improving doctor's care. In radiology, we have example, we're back to startup which is called Glimmer in radiology. In medication, we have back to a startup that's called Synapse, and which who are doing amazing things in medication with their AI platform. So I think the future will be hybrid, and it's an exciting time for healthcare innovation.
Yeah, very comprehensive round. Thank you very much. Let me now ask you a couple of questions. One of them is really provocative and coming from the audience. I mean, I've heard about the good thing of COVID, the fact that it was sort of a wake-up call. They increased attention from politicians. And the question from Peter Julius is from a pure business perspective. So let's forget about the tragedy and all the deaths and the toll we are paying for this. But from a business perspective, is it better with or without COVID? I mean, did it leave any positives aspect in your organization and your healthcare systems? And Dominik, you're raising your hand, so glad to hear what's your perspective here.
Stefano, thank you. Of course, morally and ethically, it's very difficult to talk about something being positive that has cost the tribute of a lot of lives. But of course, I mean, Churchill has told us never waste a good crisis. And I think with that, we can have a positive outlook that maybe the situation has served as a catalyst in a certain way to accelerate certain business processes, to ameliorate the entire situation and how we deal with digital solutions and how much we show how quickly we are willing to adapt and adopt. So both new technologies and change our way how we think about new and modern solutions. So overall, there can be a positive side effect. Very clearly, life would be better without a virus such as COVID, but the side effect I regard for the healthcare system as positive, only the side effects.
A positive side effect. Yeah, thanks for that. I mean, it's always hard to find some positive aspect within a crisis, but of course, once again, the death toll, in a way, we need to overcome that by the clinical point of view and extract some key organizational learnings for healthcare systems and health organizations. Ultimately, I mean, the mRNA vaccine story and how it would possibly translate to future pandemics or cancer care, just as an example, now that the technology is more ready than only 12 months ago, is certainly another quote-unquote positive side effect. For the ones of you who have experience with home care, I mean, we've heard about the hospitalization and the need of an intermediate layer between hospitals and home. Is your impression that will it exactly be like that? So hospital, outpatient facilities, home, or we will skip completely the outpatient setting and try to force the transition into home care? What's your best guess? How do you see this transition coming? Eyal.
So we have started to promote a model actually before COVID of hybrid hospitals where I'll give an example by what I mean hybrid, where one, for example, internal medicine department has both physical beds as well as virtual beds, and the doctors in the department can actually transfer patients from one to another based on their clinical situation and how stable they are and so on. So if you're examining a patient one day and you think there's no reason to put him in a hospital, you can continue to treat his acute condition at home. You would take responsibility over that patient at home, but the doctors would stay at the hospital and would examine the patient at home using technology, monitor the patient at home using technology, make decisions for the patient at home, and discharge the patient from hospitalization in his own home. It's an more high-tech version of hospital-at-home model, which is known for a while now, but traditionally had doctors and of course nurses go from home to home to treat patients at their home. Now with technology, telehealth, of course, we're able to extend the accountability of hospitals to patients that are hospitalized at home. And I think this version of hybrid hospitals having both virtual beds as well as physical beds is a way to move forward. With time, it would cause a shrinking or downsizing of hospitals because we won't need the full bed capacity we have today. We're starting to see it happen in many countries already, not so much because of hospital-at-home programs, but because of preventive medicine and so on. But I think, looking 10 years into the future, we're likely to see about 70% shrinkage of hospital size in a matter of 10 years, which is what we've seen over the last 50 years happening only in the next 10 years, which is going to be a major shift to the healthcare market. And as you talk about what's good for business and what's not good for business, if you're in the hospital business, you might be running out of a market. But if you're aiming towards solutions for the home, digital health and so on, then you have a great market ahead of you.
Yeah, great plans of the future. I mean, I remember when I was in medical school, we had some 230,000 beds in Italy, and we now have not so many years are passed. We have less than 190,000 because we really changed the way we deliver some. We take care of patients and we deliver some surgery, as an example. Dear panelists, I mean, 1 minute to go. Wanted to thank you again for participation in the session. Great to hear from your very diverse background, and I'm pretty sure our attendees appreciated the many insights you shared with us from the increased attention that COVID put on your agenda and the need to reshape the organizations to something about how to support clinicians and how the mix of doctors and non-doctors, nurses, technicians will probably be in the future. Challenges about data exchange, collaborations across the board, private, public, home care. And I like how Franck said this was a rehearsal and a wake-up call for our future. So let me thank you again for participating. It's been a privilege to moderate the session. Hope to see you very soon in person, and thank you all again.
Thank you.
Thank you.
Bye.
Bye-bye.
Thank you, Stefano. Bye.